Proposition 46 incorporates changes to a variety of unrelated medical items. The first change is raising the maximum cap for certain malpractice lawsuits. The second is requiring all doctors to use a database for monitoring patient use of certain narcotics. And the last is mandatory drug screening for healthcare professionals. We'll address these one at a time. The first change has to do with a cap on medical malpractice lawsuits. Since 1975, there has been a maximum penalty of $250,000 that can be paid for non-economic damages in a malpractice lawsuit. This is the portion of a lawsuit that awards damages for things like pain and suffering or emotional distress. This proposition would increase that cap to $1.1 million and continue to adjust the amount for inflation in future years. It is hard to get an exact figure on medical malpractice costs, since the number of suits and compensation awarded varies drastically from year to year, and often the details of suits are kept confidential. In 2012, there were at least 20 malpractice lawsuits that awarded the plaintiff at least $1 million, and the total of the 20 lawsuits studied awarded a total of $238.1 million. This is excluding lawsuits that awarded less than $1 million, as well as lawsuits that were kept confidential. Approximate data suggests that 7 to 8% of physicians are in the midst of a medical malpractice suit annually, but only about 2% of physicians will actually pay some kind of compensation. In terms of healthcare costs, there are estimates that the contribution of things like malpractice insurance and malpractice lawsuits account for roughly 2% of total medical costs in the United States. Estimates are that the increase in medical costs resulting from this cap increasing could be somewhere in the range of 0.5% of medical costs. I need to stress that the $250,000 cap is only for non-economic damages, often what we consider as emotional pain and distress in a lawsuit. If someone is crippled by some malpractice event and rendered unable to work or left in some type of assisted living situation, the compensation for economic damages remains unlimited whether or not this proposition passes. Non-economic damages would cover things ranging from feeling self-conscious because you think a scar you are left with will make you less attractive, to the pain of losing a child to something preventable. While it's unlikely plaintiffs will suddenly start getting $1 million in compensation for being left with an extra scar on their back, this proposition brings us to a very difficult ethical question. Just how much is a human life worth? 250,000? 1 million? Prison time? There is no easy answer for this, certainly not one that can be discussed in a short online video. But if you think that a parent should receive more than 250,000 for losing a child due to medical malpractice, passing this proposition will allow for that. The next component of this proposition deals with the Cures database, a database for monitoring prescriptions of certain controlled substances. The database has been active and used for quite some time now, with roughly 12% of doctors in California registered to use it. The goal is to prevent the overprescription of certain drugs to drug addicts and dealers by monitoring how many prescriptions they obtain. It is used by both physicians and pharmacists to both enter data and check for abnormalities in drug prescription, as well as law enforcement officers when looking for drug abuse. This law would require all doctors to use the database to ensure more accurate reporting. I should point out that currently the database does not actually have the capacity to accommodate this much usage at the moment, although it will hopefully be upgraded by the end of next year to be usable for all of California. Lastly, the proposition also requires doctors to submit to drug screening tests regularly and after incidents resulting in mistakes or patient injury. All episode of House aside, in a study published in Critical Care Medicine in 2007, it was estimated that approximately 10 to 15% of all healthcare professionals will misuse drugs or alcohol at some point in their career. This number can seem somewhat frightening, but keep in mind that this includes doctors that have had problems at any one point in their career and not necessarily have chronic abuse problems. This can also include doctors that have abuse problems outside of the job, going home and getting drunk after a particularly bad day, but still showing up sober to work. And lastly, I suppose it also includes the amazing Dr. House, who abuses his painkillers every day, yet somehow still seems to successfully diagnose every patient. To be clear, doctors already are administered drug tests whenever there is some reason to suspect abuse. Many hospitals and practices even have resources specifically for treatment of doctors with drug abuse problems. This proposition would make the random drug testing of doctors mandatory, as well as requiring tests whenever there is a problem connected to a particular doctor. Obviously, there are many components of this proposition, with a variety of costs and benefits. As you can imagine, many lawyers are highly supportive of this proposition, as it would increase the potential for more expensive lawsuits. Doctors and insurance companies, on the other hand, are quite critical of the proposal, as they would see increased costs and inconvenience. On the one hand, it is true that California will see an increase in both the cost and frequency of malpractice lawsuits, both frivolous lawsuits and legitimate ones. On the other hand, the increased risk may motivate hospitals to increase safety measures and ensure better patient care. On top of that, people who do have legitimate malpractice lawsuits dealing with death and crippling injury will be able to receive greater compensation that many may find more appropriate. It will be true that using the Cures database will take up more time for medical workers, but we kind of wanted them to use it right now anyway, and we may save some costs by limiting prescriptions given to drug addicts. We will see increased costs associated with the drug screening of doctors, but at the same time, this is practiced in a wide variety of occupations, and it is possible that catching more doctors abusing drugs will decrease instances of medical mistakes. Clearly, this is a very complicated set of costs and benefits, but altogether, it is not likely to increase medical costs by more than 2% or so.